The Ministry of Health has declared that Jamaica will not participate in any clinical trials for the COVID-19 vaccine. Countries like the United States and England have already started testing vaccines on humans. However, speaking on TVJ's All Angles on Wednesday, Chief Medical Officer Dr. Jacqueline Besesa Mackenzie explained that the country is simply observing what is taking place with the trials. Kelisha Williams reports.
Scientists across the world have been racing to produce a safe COVID-19 vaccine as soon as possible, a process which usually takes years. But so far, they have been failing. From volunteers developing neurological conditions to spinal cord injury after taking the vaccine. This has intensified public disquiet, with persons asking if they will be forced to take a COVID vaccine in the future. Jamaica has already thrown its support behind the COVAX initiative, where over 170 countries are working to ensure that once a safe and effective vaccine is created, it is fairly distributed worldwide.
Jamaica, pretty much where the vaccine trials are concerned, are really observing what is happening in other countries. I mean, we are hopeful as any other country that a vaccine is developed early.
On TVJ's All Angles on Wednesday, Chief Medical Officer Dr. Jacqueline Besesa Mackenzie was asked whether Jamaica will go as far as participating in the trials. There has been fear that developing countries like Jamaica will be used as guinea pigs for testing the vaccine.
No, we have not.
Okay.
We are not participating in any vaccine trials.
While she explained that many persons put themselves at risk by participating in trials, she said persons have to remember the process.
The first part, of a study is the first phases would involve ensuring that there is stimulation of an antibody response by this vaccine. And then once it is that you recognize that there is an antibody response, then you start to test it in animals, maybe in small numbers, persons, to see if there is efficacy, if it is efficient in producing these antibodies, if it is safe. And once you have established that there is safety in small numbers, then you go to larger numbers. So it is not something that you just pick up and you just give to people just like that.
Kelisha Williams, TVJ News.